My name's David Collem, from just outside Philadelphia originally. Grew up in a small town. Both my parents were into sports, but none of us 5 kids were into sports. My best present was the science kit, the latest science kit. We were working with plants. I was always kind of a nerdy kid. Worked in the trades for a while. My father was a plasterer, my uncle was a plasterer. And so I learned, the old time plasterer you don't see much anymore, white coat and various stuff in that trade. And did that for over a decade as a contractor, then went back to school to be a podiatrist. And it was actually my wife's idea, because I was looking to do something in medicine, but I wasn't quite sure. She said, well, check out podiatry. And when I checked out, it looked like podiatrist was having fun. The patient seemed to like the podiatrist, so I'm like, wow, this is pretty cool. I chose that and went to the same school that Dr. Allen in this practice went to, and went actually at the same time. That's how I met Dr. Allen. After residency and looking for work, I ended up working for another outfit down here, mostly doing mobile podiatry. And then I joined Dr. Allen about 3.5 years ago. He was trying to expand and needed help, so I joined my friend, and it's been great ever since. Well, the thing about this job is, it's one of the beauties of podiatry, is a lot of the things you treat, you can make somebody feel better right away. It's a lot of hands-on and things you can address right away and give people relief. Especially most of our patients are geriatric, most of them are older, and when you can keep them moving, you're keeping them alive longer. Moving is everything. Once they get to where you're just sedate, sitting in your chair all day, and that's when problems can really develop. So keeping people pain-free and moving around, it's very rewarding. And then there's also a personal side of podiatry. It's almost like you're kind of like the bartender of the medical field. People come in and you'll even hear everything that's non-foot related, and that's actually kind of what I like about it, because you become, you're friends with your patients. I mean, they try to teach you detachment in school, but that can be tough when you're seeing, especially in podiatry, a lot of the people you're seeing routinely, you're seeing every few months. So you build a relationship. I think, back to, when we were talking about Dr. Allen and I, our backgrounds and stuff, we don't really put our egos at first. We're really all about caring. We actually really care. We have patients, if they're not getting better right away, when we go home, we're still thinking about them. So when it comes to doing the extra things, or even if it comes to, what's best for the patient is something that we don't have the equipment for or something, we don't hesitate to refer them to get what they need. The patient always comes first. We care about our patients. We think about them even when we're not at work. I know more so than even Dr. Allen often goes out of his way to help people, that can't afford treatment and stuff like that. So there's a lot of heart in this practice that I'm sure you see in some practices, but from things people tell me, most practices are not like that. The emphasis isn't, what you can build. The emphasis is how you help somebody, and if you go to sleep at night feeling really good about what you do and getting meaning out of your life.